American Cancer Society by Lauren McCullough on the Voices of Black Women study. And then after that, the keynote speaker would deliver her speech. So, Lauren, it's all yours.
Okay, well, thank you so much for the opportunity to be able to share. My name is Dr. Lauren McCullough. I'm a visiting scientific director at the American Cancer Society and co-principal investigator of Voices of Black Women. And so I'm happy to be able to share this study with you all today. So just to talk a little bit about the problem and why we're here, as I'm sure many of you are aware, we see pretty robust disparities in cancer mortality in the United States, specifically between Black individuals and their white counterparts. So what you're seeing here are really just a comparison of death rates between Black and white women in the United States. And what I'm showing you on the left are just the top sites among women. And I'm particularly highlighting endometrial breast and colorectal cancer because they have some of the largest disparities. And because of the prevalence of these cancers, eliminating disparities in these three would actually eliminate disparities for cancer differences for Black women overall. So other things we know is that Black women tend to be diagnosed at later stage with more aggressive disease, and they also have higher death rates across every stage of cancer. And we also know that these disparities are magnified in younger women, both for cancer incidence and mortality, particularly in breast cancer. There are a number of different contributing factors. Obviously, genetics and molecular characteristics play a role, but not as large of a role as previously thought. There are other factors, including lifestyle and behavior, social determinants of health, access to health care that drive a large proportion of these cancers. But there are also a lot of things that we're still unraveling. The contributions of comorbidities and competing illnesses, as well as individual and systemic racism, are emerging topics that are still under study. And of course, when we think about this population, we have to also consider how racism contributes to the health of Black Americans. We know overall that Black individuals are much less likely to have longer life expectancies. And similarly, when we look across different conditions, health conditions in the United States, with very few exceptions, Blacks experience higher death rates compared to their white counterparts. And this is for diseases like heart disease, stroke, flu, COVID, HIV/AIDS, kidney disease, etc. And so thinking about the context of health overall for Black Americans is really an important consideration. But at the American Cancer Society, of course, we are hyper-focused on cancer. There are a substantial number of studies that exist that have looked at causes and drivers of health disparities over the last few decades. You can see by looking at these cohorts presented here, many of them are more historic cohorts recruiting women in the early to mid 1990s. A lot of them don't have large numbers of Black women in them. And so it makes it difficult to begin to think about prevention messaging for different segments of the Black population because Black individuals are not a monolith. And then, of course, I just told you that we're seeing increasing cancer rates among younger women. You can see that a lot of these cohorts begin recruiting at ages 40 or 45. And so we're really not gleaning new insights into what's happening in this younger demographic. And so the ACS has been leading research for cancer prevention for decades, beginning over 70 years ago and recruiting nearly 2.5 million people. The studies are outlined at the bottom, and you can see the number of participants have really grown substantially. And then with the most recent cohort, Cancer Prevention Study 3, there was really an intentful focus to recruit a more diverse study population. And despite those efforts, that study really only has about 5% of Black individuals in it. And so we really need to better understand what's happening in this group, particularly Black women who suffer disproportionately from cancer and other diseases. So we begin this effort in 2022. And I will be the first to say that, just because you've done this type of work doesn't mean that you understand the challenges in doing research in minoritized populations. And so what we did was really to do a lot of formative work to better understand what were the barriers and what were the opportunities to having Black women engage with us in research participation. And so multiple barriers emerged, as you can imagine, empathy and respect in healthcare settings, medical mistrust, logistical and technical barriers. And these were some of the things that we used, or some of the insights learned that we used to design this new study. And so I always like to share the guiding principles of transparency, rigor, accountability, and impact, because that is what has guided the design of the study and designs our approach in thinking about how we want to conduct medical research. It's also important to share the people that are behind this study. So it is launched by the American Cancer Society, but the individuals you see on this screen are the people that are working day in and day out to ensure that the study is representative and serves the women that it intends to. And one of the things I always like to highlight is that from study leadership to communications to even just who's doing our marketing and promotion, you can see that over 80% of this study is really led and backed by Black women. Another important partner are our Voices ambassadors. So they are volunteers who we view as trusted messengers who work with the ACS to amplify the study in their networks and in their communities. These ambassadors have been so essential in our initial launch of the study, which began last May, sharing their experiences and their why in media. They're out at walks, talking to the community, sitting on panels. And so I've just highlighted representative pictures from 3 of our ambassadors. But to date, we have over 400 ambassadors who have partnered with us to share their knowledge about the study within their local communities. And so I'd like to just end just talking a little bit about the study, what it entails, what we're asking women to do. So we have set a goal to have 100,000 Black women participate and partner with us in this study. This study seeks to recruit Black women between the ages of 25 and 55 years old. And these women should not have been diagnosed with a cancer previously. If you have a family history of cancer, that's fine, but we're just asking that the individual that joins the study not have been diagnosed with cancer, except for certain skin cancers. And women can reside in any state or the District of Columbia because this study is fully online. What the study entails. So when you first interface with us online, a woman would fill out a short eligibility survey that takes about 5 minutes. Then review the informed consent. As with all research, we want to ensure that every participant knows what's involved, understands, and has an opportunity to ask questions. And so this process takes about 10 to 20 minutes. Then a woman would fill out a registration survey. So this ensures that we have your name and phone number and address and email. That way we can connect with you over the duration of the study. The bulk of the first interaction is really filling out that baseline questionnaire. We call that our life and health history survey. It takes about 60 minutes to complete. You don't have to complete it in one sitting because it's online. An individual can leave, go do something else, come back, pick up right where they left off. But I always tell women, in a study like this that's completely observational, it's like going on a first date. That first date is a little longer because you're trying to catch up, get to know the person, understand their history. And so this first survey is a little longer because we have to ask about all the things that you've been exposed to in the present and in the past. And then once you've done that final survey, you're fully enrolled. And what we ask women is really just for an hour of their time per year. So 2 30-minute requests throughout the year just to get updates on their health and any health conditions. So really an hour investment per year to substantially change the landscape of our understanding of cancer risk and progression among Black women. So just for your awareness, that life and health history survey covers a number of different things. Of course, we talk about what's sort of standard in health studies in general, like demographics, health-seeking behaviors, cancer screenings, medications, and supplements. We also want to know about your behaviors and lifestyle. So history of tobacco or alcohol use, your diet and diet environment. Sleep is an important consideration, as well as personal care product use. And I know there's been a lot of buzz about that in the last year and particularly the last week. And then, of course, there are several new components that we have designed specifically for this population, questions around mental health and quality of life, social support and social interactions, generational wealth, which is an important consideration and much understudied in the context of the medical literature, as well as experiences of racism and discrimination. So I ask that if you are eligible, that you visit our website, voices.cancer.org. There we have a lot of information about the study, as well as a list of frequently asked questions that you could review. If you still have questions, our study team is standing by and ready to take them. If you're not eligible for the study, please consider sharing this link and your knowledge of the study with at least 5 women you know who are potentially eligible. Thank you so much.
Okay, we'll take a few questions for Lauren, and we'll go to the next speaker. Any questions for Lauren from the American Cancer Society? I hope you will be able to transmit this message to all women in that age group so that they can participate in this study. Okay, Antonio, Dr. Baines. Is there a comparable study for men?
So not at this time at the American Cancer Society. There are several ongoing studies throughout the U.S. at various cancer institutions. I don't know of a population-based study for cancer risk, but there is a nationwide study for cancer outcomes called RESPOND. But I don't know of a comparable study hyper-focused on men for cancer risk.
Yeah, this is very important because that was part of the conversation this morning. How do we get the message out there so that people can participate in trials? It's an example of something that is out there. We have a conference inviting the community to participate. So the expectation is that we'll be able to get this knowledge and transmit the knowledge to the community. And then hopefully someone will benefit from the trial. So let's give Lauren an applause and thank you for
so much for having me.
addressing the audience this afternoon. All right. Thank you.